Hello, I am AARP Vice President Yvette Peña, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you would like to listen to this telephone town hall in Spanish, press *0 on your telephone keypad now. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. Today, we're going to discuss the latest on the impact of the pandemic on Latinos in the U.S. and share critical information on staying safe, prevention, and vaccine distribution. We will also talk about how and why the pandemic is disproportionately affecting people of color, particularly the Latino community, and what is being done about it. We have distinguished experts on hand to answer your questions live. For those of you joining us on the phone, if you would like to ask a question about the coronavirus pandemic, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. And if you would like to listen to this telephone town hall in Spanish, press *0 on your telephone keypad now. If you are joining on Facebook or YouTube, you can post your question in the comments. Hello. If you're just joining us, I am Yvette Peña with AARP, and I want to welcome you to this important discussion on the global coronavirus pandemic. We are talking with leading experts and taking your questions live. To ask your question, please press *3, and if you're joining on Facebook or YouTube, you can post your question in the comments. We have some outstanding guests joining us today from President Biden's COVID-19 task force, Univision, the Hispanic Federation, and Justice for Migrant Women. We will also be joined by my AARP colleague, Veronica Segovia-Bedon, who will help facilitate your calls. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with AARP staff, or if you're joining us on Facebook or YouTube, place your question in the comments. Now, I would like to welcome our guest. Cameron Webb, MD, is a Senior Policy Advisor, COVID-19 Equity, White House COVID-19 Response Team. Dr. Webb is a practicing physician at the University of Virginia Medical Center. Welcome, Dr. Webb.
Thank you for having me. Excited to be here.
And next we have Dr. Juan Rivera, MD, who is the Chief Medical Correspondent at Univision. Welcome, Dr. Juan.
Thank you for this great opportunity, Yvette and AARP.
Next we have Frankie Miranda, who is the President of the Hispanic Federation. Welcome, Frankie.
Thank you, Yvette, for having me. Saying hi to everybody from New York City.
And next we have Mónica Ramirez, who is the founder and president of the organization Justice for Migrant Women. Welcome, Mónica.
Thank you, Yvette. It's really wonderful to be here with all of you for this conversation.
So let's begin. I'm looking forward to our conversation and our listener questions. Just a reminder, to ask your question, please press *3 on your telephone keypad, or you can drop it in the comment section on YouTube or Facebook. This conversation is happening today as we continue to see that COVID-19 is hitting Latinos particularly hard. One study in California showed that working-age Latinos were dying at 5.5 times the rate of non-Hispanic white people of the same age. This is a serious issue for the community, and we have the experts here today to answer your questions. So with that, Dr. Webb, let's begin with you. COVID-19 has had a devastating impact on our community. Why have Black and Brown people been impacted so unequally, and what is being done to address it?
Well, it's a really important question, and I think the simplest answer is that while this virus itself doesn't target people based on their race or ethnicity, it does take full advantage of this idea of social disadvantage. And the virus has been able to spread in certain communities because of a lack of investment, a lack of support, a lack of healthcare access, and a lack of resources in a lot of communities. And I think that's part of why we've seen such a devastating impact in Black and Brown communities. And I think it's easy for people to think through the healthcare access component. And Black and Brown communities disproportionately are more likely to be uninsured, and so that's part of it. They're also more likely to have chronic medical conditions, and we know those medical conditions put you at greater risk for severe outcomes with COVID. But that doesn't explain the full story. The thing is, Black and Brown communities are also more likely to be frontline essential workers, whether that's in healthcare settings, whether that's in transportation settings, or in food services, really running the gamut in terms of the folks who weren't able to have the privilege to sit at home and quarantine or isolate during this pandemic. A lot of those folks were Black and Brown individuals. They literally kept our country running during this pandemic and paid a steep price for the lack of protection in terms of personal protective equipment, lack of protection in terms of access to other resources along the way. And so that's why it's so important that when we talk about COVID-19 equity, we have to think about addressing those dynamics. People will talk about housing as being one of those dynamics and transportation as being one of those dynamics, but we have to incorporate all of that into our concept of COVID-19 equity. And that's why the vaccination effort is so important. Recognizing these communities have been the hardest hit in so many ways, it's not at all acceptable for them to lag behind in vaccination rates because of the same systemic and structural issues. And so I think, it's deep-seated. It goes back as long as this nation has existed. It has, continued to perpetuate inequality. But I think this is one of those moments where we're all shining a light on it in real time and saying we have to step up.
Thank you, Dr. Webb. Very important information. And if you're listening today and want to learn more about this, you can visit aarp.org/coronavirus or aarp.org/el coronavirus to learn more. Dr. Juan Rivera, let's turn to you. While cases and hospitalizations have fallen from highs in January and the pace of vaccination is picking up, we're seeing another rise in hospitalizations and cases in several states. What is driving this?
I think, Yvette, that there are several factors that are driving that increase in cases and hospitalizations that we're seeing recently. One element is the new variants, but in particular, the B.1.1.7 variant, which is becoming the more predominant now in the United States. This is the UK variant that we know it's more transmissible. And there is a little bit of evidence that suggests that it could be more lethal as well. So that in combination with the fact that we are seeing a loosening of some of the preventative measures in certain states and in certain cities, I think can explain why we're seeing this increase in cases. I think that it's also important to state that the increase in cases that we are seeing and we will probably continue to see, it's mainly in younger individuals. This is because you have a significant percentage of the population above the age of 65 that are already vaccinated. So we are seeing that the new cases are in people, let's say, younger than 40 years of age, or much more than what we are seeing in older populations. So I've always told my audience that we are in this race, and it's very simple. We are in a race between how quickly we can vaccinate people and how quickly versus how quickly these variants can spread in our communities. And this is the importance of vaccination. Why? Because we know at this point in time that the available vaccines do a decent job in terms of protecting us from this particular variant.
Thank you, Dr. Juan. We know that vaccine access is critical, and currently Latino communities have a lower rate of vaccination. Just 16% of Latinos in the U.S. have been vaccinated, compared to 28% of non-Hispanic white people. This disparity needs to be addressed by improving access to vaccines and providing better access to information. With that, I'd like to bring you here now, Frankie. What is the impact of misinformation being shared by word of mouth and via social media? And can you share some examples?
Thank you, Vet. I think that to answer this question properly, I want to just spend a minute to just talk about the difference between misinformation and disinformation. Misinformation is false information that is spread regardless of whether there is an intent to mislead. On the other hand, disinformation is information that is deliberately provided to mislead and knowingly sharing biased information or manipulated narrative. So there is a difference between misinformation and disinformation, and it comes to intent. So when people spread misinformation, they often believe this false information that they are sharing, and then this information that is crafted and intended to mislead people can become misinformation. So what I want to emphasize here is that sometimes in our community, people are sharing false information without knowing that is false information. And it has been created on purpose, targeting our communities by people that want to make sure that we don't get the right information. So what we have heard is basically ideas about that the vaccine is going to change your DNA, that the vaccine is going to make you sick, that it has the virus in it, and that is why you're going to get sick. Also, there has been some stories about microchips that are implanted, or that this is somehow related to some sort of religious or evil plan that again is against religion. All of this is information crafted to confuse our community. And we know that in Spanish language specifically, most of these posts on social media have not been properly labeled, or that have not been targeted, and continue to be shared. And people feel that this, because it is posted online, it is real. Our important advice to everybody is that in order to get the right information, it's to listen to the news, to go to organizations like AARP's website, or talk to community-based organizations or your doctor in order to get the right information. We know that when there is the right person, the right spokespeople, the right ambassadors of information, our community wants to get vaccinated. So we all need to we need to do our part and make sure that when we are sharing information about the vaccine, the effectiveness, or the intent, that we do this knowingly that we have verified these facts, and that is why we're having these important conversations tonight.
Thank you so much, Frankie. Just a reminder, to ask your question, please press *3 on your telephone keypad, or you can drop it in the comment section on Facebook or YouTube. Monica, welcome, and thanks for your time. Almost 4 in 10 Latino workers who are aged 50 and older are part of the essential workforce. This includes people who work in healthcare, grocery stores, and in agriculture. What is the experience for these workers in the pandemic? And has the vaccine distribution reflected this?
Thank you, Yvette. And I just want to say that I appreciate everything that has been shared so far. It is so consistent with what we've been hearing and experiencing in the community. And I also want to say to everyone who's listening that it is likely that you probably know someone who's been impacted by COVID, or you yourself may have been become sick. And I hope that you know that we all are deeply sorry for all that you've experienced during this crisis. It's been traumatic for all of us, and particularly those who've been coping with the illness and losses from the illness. For the essential workforce, I think that there's been a combination of confusion, anxiety. To Frankie's point, there's been a lot of misinformation. And for low-paid workers, there's been this reality where workers who had not been considered or called essential, like agricultural workers and others, were all of a sudden deemed essential but not provided any of the benefits or the supports that were needed. In fact, many of the farm workers who we work with and serve talked about being given these little cards telling them that they could go to work and that they should show those cards to the authorities if they were to be pulled over in a lockdown situation, but not being given much other information, not being given the masks that they needed. There was no possibility for social distancing. So essentially, they were being called upon to keep our country moving and keep food on our tables, but they were not given what they needed to survive or to support themselves. And consequently, we've seen high numbers of COVID viruses amongst many of these frontline workers. In the farm worker community, there was a study that came out from Purdue University that said there have been over 500,000 cases of COVID, estimated cases of COVID in the farm worker community, and more than 9,000 deaths. And we know that that's not probably a true reflection of the reality, and that's only one workforce. So we have been dealing with trying to get accurate information to the community, trying to address some of the fears that have been mentioned, the concerns around whether or not information would be used by authorities against people, particularly if they were undocumented, concern that information about them getting help through the programs that were being provided, whether that be testing or now vaccination, would somehow be used against them by calling them a public charge and preventing them from one day being able to get immigration relief if and when that comes to pass. So there's just been so much that people have been dealing with, and fear of getting sick is just one part of that. I have to say that what we've seen on the ground in terms of activism from within the community, from mutual aid funds that have been created to grassroots efforts to get information to people about testing and vaccination, and now efforts to make sure that people are being able to actually access the vaccine, because it actually isn't so easy for many of the frontline workers that we're talking about, particularly people in the Latinx community and those who are immigrants and maybe don't speak English. It's actually quite challenging. And so thankfully, I think that we had a learning period during the testing phase where we were able to start figuring out how to do mobile clinics and how to make sure that we had culturally and linguistically appropriate information available. But I would say that there's still quite a bit of an information gap, and that is why we all have to continue to speak out together and speak over and over about the resources available, not just from the government, but also from the organizations on the ground across the country who want to support community members in need. And I would say for the workers who are 50 and older, the demographic that AARP's membership is comprised of, there is this additional anxiety around missing work and not being available to work, and the possibility of age discrimination against people who fall in that demographic. And that is something that we also need to be sensitive to and responsive to, so that the folks are getting the information that they need, but also the right referrals and supports where those are also needed.
Thank you, Monica. Very important information, and you're so right. Grassroots efforts are so important for our community. We will be getting to questions soon, but I want to remind you to ask your question. Please press *3 at any time on your telephone keypad to be connected with AARP staff, or if you're joining us on Facebook or YouTube, you can place your question in the comments. Dr. Rivera, we're delighted to have you back with us. We've seen a lot of questions about the different vaccines. Can you explain the difference between the 3 vaccines in the U.S.? Are they all equally effective?
Yes, of course, it will be my pleasure. The first thing I'll say is the 3 vaccines are very effective, and we are lucky, really, to have these 3 vaccines available in this country in an amazing record time, which has been a significant effort, and it has been unprecedented. So we have 2 vaccines that are what we call mRNA vaccines. Those are the Pfizer vaccine and the Moderna vaccine. They're very effective 10 days after the second dose, 95% effective. After the first dose, you get about 50% immunity or protection. It is important to note that the Pfizer vaccine, you get 2 doses 3 weeks apart. The Moderna vaccine, you get 2 doses 4 weeks apart. It is both vaccines are safe. You do have people that have the typical side effects of fever, chills, some body aches, and that can happen for 24, usually maybe up to 48 hours. But that is something that we have seen with other vaccines. Just to be very clear, nothing suggests that these vaccines, even though they are called mRNA vaccines, there is no evidence that they affect the DNA of an individual. These are vaccines that, even though this is the first time that they are used in humans, have been studied for quite some time. So it is important to specify that. It is also important for people to understand that they went through the 3 different clinical studies or clinical study phases that usually vaccines go through. The data has been reported in peer-reviewed fashion, and obviously, as we know, they have been approved by the FDA in terms of emergency approval. We also have a J&J vaccine. For whatever reason, this vaccine has gotten to a certain degree a bad rep, and I think that's because the media usually just reports on sound bites, and people say J&J vaccine, Johnson & Johnson vaccine is 66% effective. Well, it depends how you look at the outcome. And the important thing to understand here is the Johnson & Johnson vaccine, it's 100% effective in terms of protecting individuals from hospitalization or death. The Johnson & Johnson vaccine is 85% effective in terms of protecting individuals from severe illness. The J&J vaccine, it's only 1 dose. So individuals would be immune 10 days or 10 to 14 days after that initial dose. Immediately, you can see how, from a public health standpoint, that provides an advantage. Because at the end of the day, what we're trying to do here is to get more than 70-75% of the population immunized. That is the definition of herd immunity. That's how we protect others in the community. So if you do it with 1 shot, with 1 dose, versus waiting the 31 days for Pfizer or the 38 days for Moderna, that is an incredible advantage that the Johnson & Johnson vaccine has. The other thing, touching a little bit into the myths and what you hear from our community, I've heard people. I actually had an interview with Eugenio Derbez after he had an interview with Dr. Anthony Fauci. And one of the things that Eugenio Derbez was saying was, well, I worry that these mRNA vaccines are new, the technology is new. And I say, well, you know what, Eugenio, we can debate that, and I can educate you on why we think those are safe. But, by the way, then just get the Johnson & Johnson vaccine. That's an older technology. It's an adenovirus with a spike protein of the coronavirus that is injected into your body. If you're worried about that, which, by the way, I don't think you need to be worried about that, but if you are worried about that and you get the opportunity in terms of given the choice, then do the Johnson & Johnson vaccine. So I think these 3 vaccines are effective. I think this is the best tool that we have, obviously in combination with all of the preventative measures that we have spoken a lot about. And, what I've done in the past 6 months or so is try to educate the Hispanic community about vaccine safety, about the importance of doing it. And there are a lot of myths out there, a lot of, like the colleagues were saying, misinformation, disinformation. And the last thing I'll say is the following. For a long time during the pandemic, there was no information given to the Hispanic community by government officials in Spanish. It was very difficult to get information in Spanish by the CDC when it came to what was happening with the pandemic. But Hispanics were dying, and Hispanics were getting hospitalized at increased rates. So no one except us in this group and others, obviously, in our community, were talking to them. Now, all of a sudden, the government wants them to get vaccinated. It is difficult. It is difficult to earn the trust of an entire community in such a small period of time when they have been going through what we have described here that we have been going through in the community. So it is my opinion, and I said this to the HHS secretary, that if the government officials want to increase the number of Hispanics that get vaccinated, they need to partner and empower community doctors who already have the trust of those individuals to be able to provide them with the vaccine.
Great. Thank you for that thorough response, Dr. Juan. We will be getting to questions very soon. I want to remind everyone to please press *3 at any time on your telephone keypad to be connected with AARP staff, or if you're joining us on Facebook or YouTube, you can just place your question in the comments. Before we take the questions from our members, we want to address an important issue. We know that many of you are having challenges registering for vaccines because many places require sign-ups through online forms. And if you don't have access to a computer, this can be a challenge. AARP wants to help. We have established an AARP Vaccine Finder support team to assist in these cases. So if you're listening today and don't have a computer and cannot register for a vaccine in your community because you don't have access to technology, please press 1 to be added to a list to receive a phone call from AARP staff to assist. Again, if you're listening today and do not have access to a computer or the internet and cannot register for a vaccine because of that, please press 1 to be added to a list to receive a phone call. When you do, you listen to a brief message, then be returned to the call. And now it's time to address your questions about the coronavirus with Dr. Webb, Dr. Juan, Frankie Miranda, and Mónica Ramirez. Please press *3 at any time on your telephone keypad to be connected with an AARP staff member to share your question. And now, I'd like to bring in my AARP colleague, Veronica Segovia-Bedon, to help facilitate your calls. Welcome, Veronica.
Hi, Yvette.
Hi,
we
Veronica.
have our first call. We have our first call from Irene in South Carolina, and I think this would be a great question for Dr. Juan.
Okay. Hi, Eileen. Please tell us your question. You are live.
Good evening, and thank you for taking my call. I am very concerned about all of the vaccines that is out in all the communities, and then we are all concerned, and we want all want help, but we don't want other problems to creep up. I've been hearing a whole lot of things about if you take the vaccine, sometime if you get allergic reactions. Those persons that get allergic reactions, the vaccines, I understand, sometimes do them real bad. They have a real bad action, and a lot of times it's too late after they've taken the vaccines, and they just have to go through all of this agony and pain. The other thing is that I want to ask is this an experimental type that is being used on all humans, and they are not too sure. We are not too sure if it's going to work or not, because everyone is still being quarantined. Everyone is still wearing masks, and there are deaths occurring from place to place. So I'm just wondering if this is going to help us very much.
Thank you so much for your question. We'll let Dr. Juan answer your multiple questions now.
Yes. So there are a couple of questions here, and the first thing I want to express is that I understand your concerns. I think that of course your concerns are important and valid, and it is important that you get the right information so you can make the best decision for you and for your family. The first thing that I want to address is this experimental? It is not experimental in the sense that when we are when the FDA approves a therapy, in this case a vaccine, it goes through different stages. It goes through a stage 1 in which we are trying it in animals, and we are understanding the effectiveness and if there's any side effects, and if everything goes well, we go to stage 2. And in stage 2, we do what's called a clinical trial, which is another experiment, if you will, with a small group of humans. And we are, again, trying to determine, is it effective in this small group of humans? And is it causing any side effects that should be concerning us? The answer in these particular vaccines was no. So we go to phase 3 or stage 3. Now, this is a clinical trial in which included 15,000, 20,000 people, and they do it in a randomized way, which means, let's say it's 20,000 people, 10,000 people get the vaccine, 10,000 people get what's called a placebo, or let's say a sugar injection. And then they understand how many people who got the vaccine receive or get to immunity or a significant protection, how many side effects versus the people who got the placebo. All of these vaccines went through these appropriate 3 phases before the FDA approved them. So it went through the experimental phase, the same way that some of the medications that we take today went through the same phases. And it was only then that it was decided that it was appropriate for the public to receive. So it went through that experimental phase, and now it is appropriate for us to get the vaccine. Just to let you know, I got my second vaccine in January 6th. So let me ask you, I have a family, I have kids. I went through the data, I studied it, because I also had concerns, and I understood that it was safe. Do you think I'm going to get a vaccine myself that I think could potentially harm me or my family or have consequences in the future? Well, the answer is no. I want to live just like you, and I want to be safe just like you. So that's number one. Number two, is this something that is effective? Is it the right thing to do? Well, let me ask you the question. When you make this decision, I want you to think about two different elements here. Number one, the risk of the vaccine. I agree. There's nothing in life that is 0% risk. Nothing. There is a small risk for allergic reactions with the vaccine and so forth. I'll get into that in a minute. But the risk is very low. Let's take the risk of coronavirus. More than 500,000 deaths. There are thousands of people that are suffering from different sequelae, meaning some people have cardiovascular issues after they recover from the acute phase of the vaccine. Some people have neurological issues. Some people have back pain, chronic fatigue. So it's not only whether you live or die, it's how do you end up after the acute illness. So when you take those two risks, in my mind, the risk of the vaccine is significantly lower than the Russian roulette that is the coronavirus. And finally, yes, there are some allergic reactions that have been reported, but more than 100 million people have received this vaccine, and the number of allergic reactions that we have seen is extremely low. Some allergic reactions have been treated immediately, where they give you the vaccine with medication. So that is a process that, even though it can happen, the chances of that happening are very low in comparison to what could happen to a patient with coronavirus. So if someone has a history of allergies, whether it's an allergy to a food or a medication, that is not a contraindication not to get a vaccine. Now, if you had a reaction called an anaphylactic reaction, in which you had an allergic reaction in the past that required the use of epinephrine, hospitalization, or you were very short of breath because of it, then yes, you should consult with your doctor before making a decision. Those were multiple questions, but I hope I answered all of them.
Great. Very thorough response, Dr. Juan. Thank you so much. Hi, Veronica. Who is our next caller?
Hi, Yvette. We have Ronald in Florida.
Hi, Ronald from Florida. You are live. Please go ahead with your question.
Yes, I would like to know what steps are being taken to get the vaccines to the migrant farm workers in the areas where they live and work.
Monica, this would be a great question for you.
Thank you. Yes, thanks for this question. So there are many different plans underway to get the vaccine to farm workers across our country. There are a lot of organizations that are working closely with state health officials, with the federal government, with county health officials as well, to do mobile vaccinations where, in the case of migrating farm workers, like in the state of Ohio where I live, many farm workers come here to do the work. There are mobile clinics that are being planned so that the healthcare professionals can go to the camps where the workers live to administer the vaccine. And then there are also partnerships that are being formed with the health officials and the grassroots organizations who are trusted by the farm worker community to help get people vaccinated, either by helping to set up appointments or taking information to workers about how to sign up. Another effort that's underway that is really important is we've been trying to do more organizing and advocacy directly with farmers. A lot of times the work that we do on the ground is within the community, and we often actually don't have much contact with the farmers themselves. And I think in order for us to be able to reach as many workers as possible with the vaccine, it's critically important that farm worker advocates and farmers work together so that workers can have access to the vaccine on the camps or in the workplaces where they are working. And there are a lot of efforts underway across the country to do just that.
Gracias, Monica. All right,
Thank you.
Veronica, who do we have next?
Next, I have a question from the online queue from Elena. And she's asking, what can bigger companies do so that they can encourage their employees to get the vaccine and reassure them that they won't be in any danger, whether that is around their documentation status or side effects? What can large companies and churches do to educate the community?
Great question. Frankie, would you like to answer that question?
Absolutely. And thank you for the question. The important thing is that right now, the new administration is, the Biden administration is asking all states to have the same requirements for everybody starting later this month. It has been a little bit confusing in different parts of the country when it comes to who can get the vaccine, what are the requirements, by when. But once we get everybody above 16 years old being able to get the vaccine, that is going to create a lot of better access to the vaccine, and there's not going to be any confusion. Many of the states are right now working to have their plans of reopening, although we're still concerned about the possibility of a fourth wave of the vaccine. So it is important that companies work with their employees to inform them exactly what are the requirements right now for the vaccine and the information that they may need. In certain states, you will need to get some sort of certification from work, depending on the field that you work with. But at the end of the day, what we are hoping is that by the end of this month, before the deadline that was provided by President Biden, that everybody in this country understand that anybody above 16 years old can get the vaccine. That is going to be extremely important. And of course, the role of churches, we have seen it in many different churches where they have mobilized, they have become sites for vaccinations and information. They have worked out very well in Black churches across the country. And we continue to encourage that kind of collaboration between the employer, the employees, the parishioners, and the churches. And again, another part that we still want to emphasize, as it was mentioned before by Dr. Juan, and the community workers, the community doctors, right? But also community-based organizations are extremely important for our community. They have been the ones that have been providing the services throughout the pandemic, in many cases, food assistance, cash assistance, rental assistance, and much more information for our most vulnerable community. Those are the organizations that people need to continue going to get more information, and to also, many of them are becoming vaccination sites. So right now, the most important thing is that everybody gets clear information about, in every single state, that everybody in the United States and the territories can get access to the vaccine, so there is no more confusion.
Thank you, Frankie. Very, very important information, especially on this vaccine rollout. Veronica, who is our next caller?
Next, we have Peter in New York.
Hi, Peter in New York. You are live. Please go on with your question.
My question was, how long is this vaccine supposed to last? We were initially told that it was like a measles shot, one shot and you're done for life. Now it seems they're telling us it's only going to last 6 months. And if it's only going to last 6 months, it's going to be like a flu shot, changing every year, or what? And if they don't know, they should tell us. We just don't know yet. Thank you.
Thank you, Peter. Dr. Webb, would you like to address this question?
Sure thing. And Peter, that's a great question. I think that the hope was always that we can design a vaccine that can last as long as possible. And what we know at this point is the researchers who've been following this know that the vaccine provides some immunoprotection, I guess, for at least 6 months. So it doesn't mean that it only lasts 6 months. It means that that's the full length of time that they've been able to track it, and they can say it still is providing protection at 6 months. Now, they're continuing to follow that initial group of patients to see how long it does last. Now, the hope is that it lasts for a while, and we don't know exactly how long, but we do know that it seems to be somewhat durable. But you heard earlier, I think it was Dr. Juan who said, one of the challenges is that we've got these variants as well. So one of the things we'll always have to keep in mind is how well does every vaccine that we have in our tool belt, how well does it work against the circulating vaccine? So far, the vaccines that the circulating variants. So far, the vaccines that we have seem to be working pretty well against the circulating variants, particularly that B.1.1.7, which is the most predominant strain variant that we have in the United States at this point. And the vaccines still work well against that, but we have to keep a close eye. And so what we don't want to do is promise to people this vaccine will last you forever, understanding there are a lot of variables. But what we do know is the vaccines that were designed, they do work, and they do provide some good protection for at least 6 months, and we'll continue to track to see how long it lasts. And we'll go from there. It's different from the flu, just by its very nature, in that we don't necessarily expect that this coronavirus is going to be identical to the flu, and that there's a different strain that's the dominant strain every year, and you're kind of guessing to see which one is emerging to be the predominant strain. Here with COVID, it's a little bit different, but I think even still, it's still the novel coronavirus, the new thing. So we are tracking the data every single day. We're checking to see how long it's lasting, and so far it's continuing to last. So we're not seeing that immunity waning as of yet.
Great. Thank you so much, Dr. Webb. And thank you, everyone, for all of your questions. Remember, if you'd like to ask a question, please press star 3. Now let's turn back to our experts. Dr. Webb, how are people of color, particularly Latinos, represented in the development and trials for the vaccines that are being distributed in the U.S.?
Yeah, it's a really important question, and as a Black man, I hear the same question from the Black community as well. It's, well, will we be represented in these trials? And the first, the substance of that question, a lot of times, is the vaccine going to work as well in me, and is it going to achieve the same result? Well, in terms of, as far as vaccine trials go, these were very representative vaccine trials. So the Moderna trial was about 20% Latino, the Pfizer trial about 26%, and the Johnson & Johnson was about 45%. And so very good representation in those trials from the Latino community. I think actually in the Black community it was about 9%, almost 10% for both Moderna and Pfizer, and about 17% for Johnson & Johnson. But what that tells us is that, we can feel comfortable that the conclusions that were drawn about how this vaccine works, those conclusions apply to Black and brown communities as well. It is very good at preventing hospitalization. It's very good at preventing death. It's very safe, and that's true for people who are persons of color just the same. So it's useful to see, and remember those trials. Those trials were looking at over 75,000 people between Pfizer and Moderna, so lots of representation there. And then if you look a little bit farther, as of today, about 6.6 million Latino people have received at least one dose of this vaccine. So even beyond the trials, now we have this real-world experience, and 5.2 million Black people have received this vaccine at this point. It's when you look at the real-world experience with communities of color in these vaccines, we're seeing the same thing. It's still effective, it's still safe, and it's working for all of these communities. So good information. We have a lot of data points at this point. Good representation, and so feel confident that those conclusions apply to everyone.
Thank you, Dr. Webb. It's really good to see the representation, especially amongst our Black and brown brothers and sisters. Dr. Juan, what advice do you have for grandparents who are taking care of grandchildren going back to school, or households with multiple generations of people where people may be leaving the house to go to work. What can they do to stay safe?
So I think that the CDC has been very clear on this issue. I think grandparents need to get vaccinated. I think they have been getting vaccinated. And if they are visiting a home, let's say the home of a kid where there's or their son or daughter, where there's a married couple and grandkids and so forth, they can actually, if it's 10 days after the last dose of the vaccine, they can actually go and spend time with that family, especially if that family is also vaccinated. But even if the grandkid is not vaccinated, they can spend time without a mask and without social distancing. And that is the guideline by the CDC. So that is why I think that the vaccines are the best tool that we have at the end of the day. And I think this is an important message, and I think we need to all focus on this aspect when we talk about vaccines, because we talk a lot about the scientific evidence, we talk a lot about effectiveness, we talk about a lot about the fact that they're safe, and all of that is true. But at the end of the day, what everyone in this country and in any other country wants is to go back to normal. A grandfather hugging his or a grandmother hugging her grandkids, that's normal. That is normal life. And the way to get to that normal life, to get to that human contact that defines us as a species, is by getting a vaccine, getting immunity, and doing our part so that we get to herd immunity and protect the community as a whole. Now, I do want to mention something that I think is very important as well. When we talk about people getting vaccinated, we should be very clear. We are not only talking about the United States. We're talking about the entire world, because we can get vaccinated here in the United States, but if there are developing countries that are not getting the vaccines and are not getting vaccinated, coronavirus will continue, new variants will arise, and they'll make it to the U.S. eventually, and the vaccines might or might not work. So vaccination is for the entire world. The entire world wants to go back to normal. It's not only us.
You are so right. The entire world is affected, and they all want to get back to normal. Thank you for this great information. Monica, women, particularly Latinas, have been hit hard from the pandemic. They've had a harder time in the economy, and many have had to take on extra family caregiving duties. What has the pandemic revealed about the policy changes we need to better support family caregivers, particularly women?
Well, definitely this pandemic has revealed that we should have passed policies that were supportive of caregivers a long time ago, because we did not have the safety net and support in place to really sustain and support caregivers during this crisis. So we need policies where people are entitled to paid leave, where people do have leave to be able to care for their family, where they don't have to worry about having to choose between work and caring for their family. We've seen, over 2 million women have been pushed out of the labor market. Over 1 million of the women who've been pushed out of the labor market since the pandemic started have been Latina. And we understand that the reason that it's been difficult for many of these caregivers and women to stay in their positions has been because what Dr. Webb said at the beginning, that they didn't have the right protection going into this crisis. So it isn't just about having policies that provide paid leave and paid sick leave and ability to care for your family if someone else becomes sick, et cetera. But it's also some of the very basic protections that people need. Not all of the workers in our country have the same basic rights, and that needs to change so that people can have a safety net. It's going to be very important going forward that the policies are enacted that are going to help bring women back to work, because when you have more than 2 million women who've left the workforce because of this crisis in order to care for their families, we understand that there's going to be a lot that will be required to get women back to work in positions that are equal to where they were working before, if not better, because on top of the other issues women are contending with, we also have to deal with the gaps that exist in terms of the pay gap and the wealth gap, which were already persistent problems. So this pandemic has revealed a lot, and what it has told us is that we have to keep insisting on the policies that we always knew needed to be passed, and now we're going to have to be very creative about the other kinds of policies and programs that are going to be supportive to help on-ramp women back into the workforce.
Thank you, Monica. And now it's time to address more of your questions. But before we do that, we want to make sure that you press *3 at any time during this telephone keypad to be connected with AARP staff, okay? We do have questions in the queue. Veronica, who do we have on the line?
Hi, Yvette. So we have a question from our online queue, and this is, many residents in rural communities have had a hard time accessing vaccines. What more needs to be done to ensure that rural communities have access to the vaccine?
How about Frankie and Monica for this question?
Thank you, Yvette. And Monica alluded to this before, the importance of continuing working with local authorities on making sure that there is not one-size-fits-all solution for vaccination. In different communities, in different regions, different approaches are needed and multiple approaches are needed. So right now, when it comes to rural communities, it is really important to work with either the local authorities, the community health clinic, the federally qualified health clinics, nonprofit organizations, but also mobile units. We need to make sure that people don't need to drive too many miles to get to a vaccination center. The vaccination centers need to come to many of these rural communities, and it's happening already with mobile units. And the way that Monica also described working with the farmers and also to get to the farm workers, it is really important to have a multi-pronged approach to this. At some point, the problem was that we did not have enough vaccines. Now that the quantity of vaccines is not an issue anymore, it is about collaborative and innovative ways to get to those communities that need it the most. Monica.
Yeah, I totally agree, Frankie. The other thing is making sure that the community health centers, which are the main healthcare providers that many folks in rural America rely on, have sufficient supply. One of the things that we don't talk about enough when it comes to rural America is, we don't have the same kind of broadband access in lots of places across our communities. And so getting the basic information to people about how to sign up, where to sign up, the ability to sign up, those are actually real challenges in rural America. And so we have to be thinking creatively about how outreach is happening and how signing people up to get the vaccine appointments is taking place. I would also encourage, beyond the mobile clinics, there probably have to be transportation dollars that are actually invested in the community. So where it isn't possible to set up a mobile clinic, there can be small grants given to grassroots and local groups to help drive people to the vaccination site, or to come up with some system where, the trip services or the DORA services or whatever they're called in that particular locality are available to actually transport people to where the vaccinations are happening.
Great. Thank you, Monica. Before we continue with a couple more questions, I just wanted to go back very quickly to the topic of family caregiving. I also want to add that AARP was pleased that the new economic relief law, the American Rescue Plan Act, includes an increase in the child tax credit. This is important for parents with children and grandparents who may be raising their grandchildren, and most importantly, The credit is now fully refundable and can be received as a monthly refund beginning in July. This means that more families will get money more quickly. And so, Frankie, I want to shift gears just one sec. How has civic engagement changed in Latino communities last year as a result of the pandemic?
Civic engagement was transformational for the year 2020, and our community played an incredible role in the mobilization, thanks in great part to the role of the community-based organizations. We saw the largest single increase in Latino voter participation, a 30% increase in participation. It is clear that for any political party that our community matters, and it actually makes the difference in many of these razor-thin races across the country. What we need to keep in mind is that we need to continue as Latinos to continue to work together, to get informed, to get mobilized, and to really play a big part on the American society, that we are part of the American society, but that we also need to take action. And in the purpose of this forum tonight, we need to take action, get the information that we need, and get vaccinated. We matter, and everybody noticed it in the last election cycle, but that's the start. We need to continue, and for that, we all need to get vaccinated and get put this virus into the past and make sure that our community continues to be as strong as it has been as of right now.
Thank you, Frankie. Very powerful, all of this outreach that's been happening in our communities. And Veronica, who is our next caller?
Next, we have Anthony from New York.
Hi, Anthony from New York. You are now live. Please ask your question.
Hi, how are you? Thanks for taking my call. My question is, I was always under the understanding that once you take a vaccine, that you are protected. I don't understand why we're still wearing masks. And if we do still have to wear masks, when does it end? Is it always going to be the same cycle that we always have to wear masks? If this vaccine lasts 6 months, then what do we do after it's over?
Thank you, Anthony. I will ask Dr. Webb and Dr. Juan to please respond to this question.
Sure, I'll start, and I know Dr. Juan can give some additional information, but it's a good question, because I think a lot of people were asking early on, what's the value of getting vaccinated if you still need to wear a mask? And I remind people of a couple of things. One is that the vaccines are really good, but they're not perfect. And so even though, a small percentage of people are still, are still not going to get the full benefit of the vaccine, you don't want to run that risk with a virus that can cause the kind of damage that COVID causes. So that's the first reason, it's to protect you, but also a big reason is to protect other people. And early on, there was a question in the data of whether or not these vaccines were preventing people from getting an asymptomatic infection. We know that they're very effective at preventing symptomatic infection, but it wasn't one of the data endpoints of the trial to figure out if they prevented asymptomatic infection. Now, we have a lot of indicators at this point that make us feel like they're very, very effective at preventing asymptomatic infection. But even still, that was the other reason why we encourage folks to still wear masks, is because if you had an asymptomatic infection, you could potentially spread that to someone else. Another reason is the variants and the fact that those are in circulation. I'll tell you this, I don't believe that we're going to be wearing masks forever. I think that what we're going to have to track is the rate of community spread all over the country. And the idea is when we beat this virus, when we get the rate of spread back to low levels in our communities, that's when you'll see masks go away. But we still have some work to do, and that's, everybody, wearing masks for now, maintaining your physical distance, washing your hands, and getting the vaccine when it's your turn. If we all do that, we get back to that scenario where the rate of cases is lower in our communities. We get back to that faster, and that's when you'll see things like masks, go away. But Dr. Juan, I'm not sure if you have anything else you wanted to add to that.
Thank you, Dr. Webb. I think that was a great explanation. The other perspective that I will add is the following. This is not a simple situation. And I think a lot of people think about this in terms of black or white. They think that one day we have a pandemic and the next day we might not have a pandemic. And the transition is not from one day to the next. This is an evolution and this is a process. And there are multiple things that have to be in place for us to be able to go from peak pandemic to normal life. I think that at a point in which we have a lot of cases in the country, and we have been obviously worse, we're now above 60,000. I think it's between 60,000 and 70,000 cases a day. The first thing that has to happen is we need to bring those cases down. We need to make sure that the positivity rate, in other words, the number of cases that, the number of tests that test positive of coronavirus are less than 5%. Let's use that 5%. So to be able to decrease those cases, especially when they're very high, we need measurements like masks. We need measurements like quarantines, because we don't want to overwhelm the healthcare system. We don't want to overwhelm hospitals. We want to make sure that if someone gets sick and needs to use a ventilator, an ICU, that those resources are going to be available. Now, let's say that we get to a point in which we have done that, and now the cases are low, and now we have a positivity rate of less than 5%. Well, one thing that we need at that level that I quite frankly don't think that we have established in a robust way, it's a way to do very effective contact tracing, right? Because if we have contact tracing, if we can identify where the pockets of cases are appearing once we are at a very low positivity rate, then that is when we can start getting a little bit more flexible in terms of opening society, perhaps in combination with vaccination, not using masks, depending on how the variants are developing. So it is a process. And some of the elements that we need to go from a pandemic to a normal life, some of the elements that are important we have, like vaccines, but then some of the elements like a robust contact tracing system like we have in other countries in the world, we don't. So the transition is not going to be from one day to the next. But I want to highlight the fact that by CDC criteria, if someone is already vaccinated and visiting with, let's say, another family who is vaccinated, you don't need masks and you don't need social distancing. So that is obviously progress from we have to wear masks, we have to stay inside. So this is progress that it's going to come with time. It's going to come with some of these tools working and put in place. And I understand this is difficult. Listen, I know that we don't have time to talk about this, but this has caused a significant problem when it comes to mental health, not only in healthcare professionals, but everyone, adults, kids. So I understand that people want to make masks go away from one day to the next. We want to go back to restaurants. We want to go back to theaters. We want to hug people. I want to shake the hands of colleagues. I also want that. But it's going to be a transition. It's not going to be from one day to the next. And I promise you, we are making progress. It is something that statistics show. We can demonstrate it. We need to do better. But we're already making progress. There is hope. We are going to get away of the lifestyle that we've had for the past, 16 months or so. We will be the society that we were before. But in certain times in history, circumstances arise that require that the population adapt and sacrifices. And this was our time. And we're going to be victorious. And we're going to learn, hopefully, from this. And it's going to be sad and it's going to hurt because a lot of us have lost family members and a lot of us have gone through very difficult situations. But we will make it out of this.
Thank you, Dr. Juan. Thank you, Dr. Webb. This has been a very informative discussion. Thank you to our distinguished panel for answering our questions and being here with us tonight. And thank you, our AARP members, volunteers, and listeners for participating in this discussion. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the crisis, we are providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others, while taking care of themselves. All of the resources referenced, including a recording of today's Q&A event, can be found at aarp.org/coronavirus on April the 9th. Again, that website is aarp.org/coronavirus, or in Spanish at aarp.org/el coronavirus. Go there if your question was not answered. And if you would like to find the latest updates as well as information created specifically for older adults and family caregivers, please make sure to tune in on April 22nd for 2 more live events where we'll discuss COVID-19 vaccines. At 1 p.m. Eastern, we'll focus on COVID vaccine distribution. And at 7 p.m. Eastern, we will discuss coronavirus vaccines and Asian Americans. Thank you, gracias, and have a good evening. This concludes our call.